today's session of health psychology, we will be discussing about AIDS or acute immunodeficiency syndrome. The main objectives in this lesson are to understand what is AIDS, symptoms and stages, causes and risk factors, treatment and preventive measures, and how to cope with AIDS. A gentle reminder to the audience of this session. Today's topic is highly sensitive, and I request the listener to look at it from an educational point of view to not only gather knowledge but also be sensitized about HIV or AIDS. Introduction. HIV. Human immunodeficiency virus is a virus that attacks the body's immune system. If HIV is not treated, it can lead to AIDS or acute immunodeficiency syndrome. Mentioning it again, human immunodeficiency virus infection and acquired immunodeficiency syndrome, HIV or AIDS, is a spectrum of conditions caused by infections with the human immunodeficiency virus, a retrovirus. Following initial infection, an individual may not notice any symptoms or may experience a brief period of influenza-like illness. Typically, this is followed by a prolonged incubation period with no symptoms. If the infection progresses, it interferes more with the immune system, increasing the risk of developing common infections such as tuberculosis as well as other opportunistic infections and tumors which are otherwise rare in people who have normal immune function. These late symptoms of infection are referred to as acquired immunodeficiency syndrome or AIDS. This stage is often also associated with unintended weight loss. HIV is spread primarily by unprotected sexual intercourse, contaminated blood transfusions, hypodermal needles, and from mother to child during pregnancy, delivery, or breastfeeding. Some bodily fluids such as saliva, sweat, and tears do not transmit the virus. Oral interaction causes little to no risk of transmitting the virus. Learning the basics about HIV can keep you healthy and prevent HIV transmission. So let us understand what is HIV. HIV is human immunodeficiency virus. It is a virus that attacks the body's immune system. If HIV is not treated, it can lead to AIDS, that is, acquired immunodeficiency syndrome. There is currently no effective cure. Once people get HIV, they have it for life. But with proper medical care, HIV can be controlled. People with HIV who get effective HIV treatment can live long, healthy lives and protect their partners. Where did HIV come from? HIV infection in humans came from a type of chimpanzee in Central Africa. The chimpanzee version of the virus, called simian immunodeficiency virus or SIV, was probably passed to humans when humans hunted these chimpanzees for meat and came in contact with their infected blood. Studies show that HIV may have jumped from chimpanzees to humans as far back as the late 1800s. Over decades, HIV slowly spread across Africa and later into other parts of the world. We know that the virus has existed in the United States since at least the mid to late 1970s. Signs and symptoms of HIV. HIV is typically described in phases during which certain symptoms are more likely to develop. As with the course of the condition itself, the symptoms are not the same for all people. Some symptoms may develop earlier or later than others or not at all. HIV's acute stage can last for around 2 to 4 weeks, after which symptoms will spontaneously resolve as the body brings HIV under control. The presence of HIV in the body is not gone but instead moves into the next phase known as clinical latency. Some of the symptoms may be the direct result of HIV exposure, while others, particularly those in the later stages, are caused when the destruction of the immune system leaves the body vulnerable to opportunistic conditions. In some of the earlier stages of HIV exposure, a person may be entirely asymptomatic, that is, without any symptoms, even though the immune system is progressively damaged. Some of the most serious and potentially life-threatening opportunistic conditions can occur when the immune defenses are fully compromised. HIV is not equal in the population of people it affects. Because fewer black people with HIV receive HIV specific care than those living with HIV in general, fewer can achieve complete viral suppression while on treatment. This leaves black people at greater risk of developing opportunistic conditions and dying. Note: viral suppression is defined as literally suppressing or reducing the function and replication of a virus. When discussing antiretroviral therapy for HIV, a regime is considered to be highly successful if it reduces a person's viral load to undetectable levels. Stage 1: primary exposure or acute HIV. Stage 1 is the phase when HIV enters the body and the immune system launches its frontline defenses. Also known as acute HIV, primary HIV, and acute seroconversion or acute retroviral syndrome. Stage 1 is characterized by the body's efforts to bring HIV under control. In fighting the virus, the immune system will release chemicals that trigger a whole body inflammatory response. This can lead to flu-like symptoms in 2 of every 3 newly exposed people, usually within 2 to 4 weeks. Some of the symptoms of acute HIV include fever, chills, headache, sore throat, fatigue, muscle and joint pain, night sweats, swollen lymph nodes, mouth ulcers. 1 in 5 people may also develop a HIV rash with raised reddened area of skin covered with small pimple-like bumps. The rash will often affect the upper body and may be accompanied by ulcer of the mouth and genitals. The acute stage of HIV can last around 2 to 4 weeks, after which symptoms will spontaneously resolve as the body brings it under control. The presence of HIV is not gone but instead moves into the next phase known as clinical latency. Stage 2: clinical latency or chronic HIV. Stage 2 is when the acute symptoms have largely resolved and HIV will persist but be far less active. Although lymphadenopathy or lymph nodes may persist for months following the initial exposure, this stage of HIV progression is largely asymptomatic. Also known as clinical latency or chronic HIV, stage 2 is characterized by the gradual destruction of immune cells called CD4 T cells and the gradual increase in the number of viruses in the body, as measured by the viral load. The Center for Disease Control and Prevention (CDC) of USA broadly defines the chronic stage of HIV as a CD4 count of between 499 and 200. Without treatment, the chronic phase can last for around 10 years, during which there may be a few notable symptoms. But as the CD4 count continues to drop, an ever-widening range of opportunistic conditions can develop, both common and uncommon. During this stage, the symptoms, if any, are generally related to these conditions, which include oral thrush, genital herpes, HIV-associated diarrhea, bacterial pneumonia, shingles. Shingles, also known as herpes zoster (HZ), is a painful rash that's caused by a reactivation of the varicella zoster virus, which is also responsible for chickenpox. HIV progression. The progression of HIV is not the same for all people. For some, the period of clinical latency may only last for 2 years, although there are many reasons for this, including a person's genetics, social factors like poverty and the lack of access to healthcare also play a role. Studies suggest that low socioeconomic status is associated with poorer immune status in people with HIV as measured by the CD4 count. A low CD4 count at the time of diagnosis is in turn associated with a faster HIV progression. Stage 3 or symptomatic HIV, also known as AIDS. Stage 3 is the phase where the immune system has been compromised and unable to defend itself against an ever-expanding array of serious opportunistic conditions, also known as AIDS or acquired immune deficiency syndrome. Stage 3 is defined by the CDC as having a CD4 count under 200 or the presence of AIDS defining condition. Note: AIDS defining illnesses are those which the Center for Disease Control and Prevention (CDC) has classified as being directly associated with advanced HIV infection. Many of these diseases are seen outside the realm of HIV but are considered AIDS defining either because they are more prevalent in HIV positive people or are rarely seen outside of immune suppressive disorders. AIDS defining conditions are those that occur in the setting of advanced HIV and are rarely seen in people with intact immune systems. Some infections like tuberculosis can occur at CD4 counts that count over 200 but must occur when the CD4 count drops below 200. On the flip side, it is possible to have a CD4 under 200 and no AIDS defining condition also. Even so, aggressive steps will be taken to prevent them from occurring. This includes starting antiretroviral therapy if you haven't already done so, and if you need, taking disease-specific prophylactic or preventive drugs. Symptoms at this stage are primarily related to the opportunistic conditions, although some like AIDS dementia are due to the consequences of long-term untreated HIV. Others are only considered AIDS defining if they reoccur and are disseminated, that is, widely dispersed, or are invasive. Note: T cells are a subset of white blood cells that play an important role in the body's immune system. CD4 is by contrast a type of protein found on certain immune cells like T cells, macrophages and monocytes. CD4 T cells are considered helper cells because they do not neutralize infections but rather trigger the body's response to infections. There are 27 conditions classified as AIDS defining by the CDC, and some of them are bacterial infections, multiple or recurrent, candidiasis of bronchi, trachea or lungs, candidiasis of the esophagus, cervical cancer invasive, cryptopordiosis or chronic intestinal for longer than 1 month, encephalopathy, HIV related, also known as AIDS dementia complex, herpes simplex virus, HSV, which is lasting longer than a month or appearing in an area other than the skin, histoplasmosis, disseminated Kaposi sarcoma, lymphoid, interstitial pneumonia or pulmonary lymphoid hyperplasia complex, Burkitt lymphoma, immunoblastic lymphoma, primary lymphoma of the brain, mycobacterium or similar species disseminated beyond the lung, pneumonia recurrent, progressive multifocal leukoencephalopathy PML, salmonella specticium recurrent, toxoplasmosis of the brain, tuberculosis and wasting syndrome. Even though HIV is transmitted through body fluids, not all body fluids are capable of transmitting the virus. Some fluids like saliva and urine contain high level of enzymes or acids that prevent HIV from thriving. Once outside of the body, the virus is unable to survive for a very long time and usually not at levels where transmission is likely. Moreover, the virus must come in contact with mucosal tissue such as one that is found in the rectum or vagina, or enter the body through broken skin and insufficient quantities to establish an infection. HIV can be transmitted via blood, semen, vaginal fluids, rectal secretions, breast milk. HIV is not transmitted via saliva, sweat, tears, shared utensils, toilet seats, pool or bath water and mosquito bites. Let us understand the risk factors involved with HIV or AIDS. Behaviors and conditions that put individuals at greater risk of contracting HIV include having unprotected sexual intercourse, having another sexually transmitted infection or STI such as syphilis, herpes, chlamydia, gonorrhea and bacterial vaginosis, sharing contaminated needles, syringes, and other injecting equipment and drug solutions when injecting drugs, receiving unsafe injections, blood transfusions, and tissue transplantation, and also medical procedures that involve unsterile cutting or piercing and experiencing accidental needle stick injuries. These include among health workers. Let us understand what is the treatment for HIV. The treatment for HIV is called antiretroviral therapy or ART. Antiretroviral therapy involves taking a combination of HIV medicines called an HIV treatment regime. This is to be taken every day. Antiretroviral therapy is recommended for everyone who has HIV. This therapy cannot cure HIV, but HIV medicines help people with HIV to live longer, healthier lives. Antiretroviral therapy also reduces the risk of HIV transmission. So, how do HIV medicines work? HIV attacks and destroys the infection fighting CD4 cells, especially CD4 T lymphocyte of the immune system. Loss of CD4 cells makes it hard for the body to fight off infection and certain HIV related cancers. HIV medicines prevent HIV from multiplying or making copies of itself, which reduces the amount of HIV in the body called the viral load. Having less HIV in the body gives the immune system a chance to recover and produce more CD4 cells. Even though there is still some HIV in the body, the immune system is strong enough to fight off infections and certain HIV related cancers. When is it time to start taking HIV medicines? People with HIV should start taking HIV medicines as soon as possible after they arrive at a diagnosis. It is especially important for people with AIDS defining conditions or early HIV infection to start with the medicines right away. Early HIV infection is the period up to 6 months after the infection is diagnosed, when women with HIV who become pregnant and are not already taking HIV medicines should start taking these medicines as soon as possible. What HIV medicines are included in a HIV treatment regime? There are many HIV medicines available for HIV treatment regimes. The medicines are grouped into 7 drug classes according to how they fight HIV. The choice of an HIV treatment regime depends on a person's individual needs. When choosing a treatment regime, people with HIV and their healthcare providers consider many factors, including possible side effects of HIV medicines and potential drug interactions. Prevention of HIV or AIDS. Protecting yourself from HIV begins with understanding how the virus is spread. The virus can be passed in only certain ways. During sex with a person infected with HIV, by sharing a contaminated needle such as through illicit drug use, from HIV mother to child either during pregnancy, labor or breastfeeding, through a contaminated blood transfusion. Thanks to advances in treatment, people diagnosed and treated for HIV in the early stages of infection can live normal to near normal life expectancies. Even those first treated during the advanced stages are able to bring the virus under control and avoid many severe opportunistic infections. Despite these advances, living with HIV still has its challenges, both physical and emotional. There may also be problems dealing with finances or finding adequate care. These issues may be all the more impactful for those who live in communities with limited resources or face high levels of stigma and isolation. 1. Emotional. Despite recent advances in treatment, finding out you have HIV can be overwhelming. Even after you've come to terms with the diagnosis and settle into treatment, anxiety and depression are not only possible but common. One may not only be concerned about their health and future but may feel stressed out about how HIV may affect those around them. All of these feelings are normal and it can take time to process them fully. Fortunately, there are steps one can take to better cope. By educating yourself. Myths and misconceptions of HIV abound. They not only keep people from seeking the HIV specific care they need, but can also make them fearful of disclosing their HIV status to others. When diagnosed with HIV, the best way to overcome these fears is to educate yourself. The problem is that many people and communities cling to myths about HIV that are untrue. It is only by educating yourself that you can begin to educate others. Doing so may not only change attitudes but can also help you build a support network you can turn to and rely on. Physical. HIV is treated with more than just pills. Living with HIV requires you to stay healthy to not only avoid HIV related infections but non-HIV associated illnesses as well. Today, people living with HIV are more likely to die of heart disease or cancer than from the virus itself because HIV places the body under persistent chronic inflammation. People with HIV tend to develop these and other diseases 10 to 15 years earlier than the general population. Next comes social support. Social support is very important to people with HIV infection or AIDS. Social support has been tied to greater adherence and lower viral load. For example, they addressed social support needs can help multiple positive repercussions. Interventions that include male partners and those that focus on building and maintaining relationship skills build on these insights. Support from family appears to be especially important for preventing depression. Not all families are helpful, however, and so other sources of support are vital. The internet represents an important resource for people infected with HIV. They say that those who use the internet to help manage their HIV positive status typically are more knowledgeable about HIV and have more active coping skills, engage in more information seeking, coping, and have more social support than those not using the internet. Coping skills. Stress and its neuroendocrine consequences foster a more rapid course of illness in people who are infected with HIV and lead to more opportunistic conditions, which are more aggressive symptoms. Thus, good coping skills are essential. Coping effectiveness training is helpful in managing the psychological distress that can be associated with HIV positive status. In one study, a cognitive behavioral stress management program designed to increase positive coping skills and the ability to enlist social support led to improved psychological well-being and quality of life among HIV as well. A study by K.J. Petrie and associates found that one who has control over a stressor is usually associated with better adjustment to the stressor, and this is also true for HIV. Summary. Acquired immunodeficiency syndrome or AIDS was first identified in the United States in the year 1981. It results from the human immunodeficiency virus or HIV and is marked by the presence of unusual opportunistic infectious diseases. HIV causes AIDS and interferes with the body's ability to fight infections. The virus can be transmitted through contact with infected blood, semen, or vaginal fluids. Within a few weeks of HIV infection, flu-like symptoms such as fever, sore throat, and fatigue can occur. Then the disease is usually asymptomatic until it progresses to AIDS. AIDS symptoms include weight loss, fever or night sweats, fatigue, and recurrent infections. No cure exists for AIDS, but strict adherence to the antiretroviral regimes, ARVs, can dramatically slow the disease's progress as well as prevent secondary infections and complications.